Like our philosophy is we want to do everything that we can to be there for our patients so that we build a relationship with them and we build a trust with them. We're not just a reactionary medicine company of tell us if something's going on. We want to catch things before they happen. We try to prevent things from becoming a problem and to keep you healthy and to do anything that we can so you can live your best life like right now.
Hey everyone, it's Tamara Thompson from Broadcaster Authority, and I'm here with my co-host today, Danielle Thompson, and she's going to introduce our guest.
I'm here with Justin Cooper, a co-founder of PracticeRx, a concierge medical practice focused on delivering personalized, preventative, and integrative healthcare that supports long-term wellness and vitality. Justin, I know you've been in the medical field for a while. Go ahead and introduce yourself.
Yeah, I'm Justin. So I'm one of the co-founders, like you said, of PracticeRx. It's Clay Hall and myself. So just really happy to be here. I feel like our business is something that we're really proud of, that we're excited to share. And as we're growing the business and continue to see the growth, we're just looking for every opportunity that we have to talk more about it, to provide these opportunities, not just for people in Arizona, but as we expand throughout the country. So it's a really exciting time for us.
Awesome. And you started your journey actually in different areas, like the co-founder that you became good friends with, colleagues with. Can you share a little bit on your backstory about how you two met and how you got to this point today?
Yeah. We actually met in 2010 working on an ambulance. So we were both doing EMS services. Yeah, seriously. So I was an EMT, he was a paramedic, and we just hit it off. He's one of the people where it's like you become best friends instantly. It's like stepbrothers. Did we just become best friends? And so we just kept a friendship throughout the years. And as we both became firefighters, and then we both left our fire departments here in Maricopa County in Arizona to pursue, he became a nurse practitioner. I went to physician assistant school through the military. And ever since then, we've maintained our friendship. And now this is our second business that we've been a part of together. So it's a really great partnership and a great friendship.
That's incredible. How did you, we actually found out, Danielle actually found out a little bit more about the company that you're running right now, and would love to actually the mission behind it and how you're helping more people on more of like an affordable type of way, but thinking different than just regular healthcare. Can you share a little bit more about what the company actually does and provides for individuals and even business owners? No,
for sure. And so it started with just us saying, for a flat rate, we don't accept insurance. It's just a cash pay concierge business. And we were like, we're 7 days a week. Here's our personal cell phone number. Call us if you need us, text us. And that was kind of our marketing strategy at the beginning, was you just text us.
Personal touch.
Yeah.
It's,
hey,
I'm
Clay,
reach a real person, not AI.
Right. And you're not talking to our front office staff. Like I literally give my patients my personal cell phone number. And both of us came from a family medicine service, and I've done emergency medicine, family medicine. And so often what we found is what people really need is they need access that's quick. Like my wife today is the perfect example. She has a sore throat and she's like, where can I get a strep test? I'm like, I got you. And so it's that kind of thing where she doesn't have to wait until the end of the day to be seen at a family medicine clinic. She doesn't have to wait in an urgent care office for 4 hours. So we want to offer.
Is that how it works though with each and individual membership side of it? Like if you have something like that day, you're literally like, I need to see someone. Is it a specific person like in your network? Is it you, or are you building out like other people in the arena? Like how does it really work?
So right now, the way that the nuts and bolts of how it works is we do, I would say probably 90 to 95% is telemedicine. Most of what people need is something that can be dealt with a simple text or a quick phone call or a Zoom. And when we're not constrained by insurance, because before when I did family medicine, it's like, oh, well, insurance won't cover it if we don't do this and this and this. Now we don't have that. So it's, hey, Justin, can I get a refill of my medication real quick? Absolutely, it's sent. That's it. Like I just had somebody, I was camping with my boys this weekend up in northern Arizona, and one of my patients called me and he said, hey, I need a refill of this medication. I'm like, hold on 1 second. And I texted him back and I said, you're good to go. And
that's amazing.
Rather than saying, oh, I'm out of town, let me see you when I come back in, we'll make an appointment to come into the office and then we can see each other. No, we're all busy. Like I'm a father of 3, I'm married, I'm a very busy person as well. And so anything that we can do to make our patients, our clients' lives easier, that's legitimately what we want to do. And so the majority of the time we don't have appointments. If we have multiple people that need to be seen, most people are okay saying, hey, I'm with someone else right now, I'll get back to you in 10 minutes. Okay. So The vast majority of the time, it's all telemedicine and it's convenient. People are able to talk to us from their home. I had alluded to it earlier, but we have, I don't know how many states we're in, like 15 different states between Clay and myself of the different licenses that we have. So we're not just constrained to Arizona. We're building this out where we can take care of people and help them in a convenient. And also when you have healthcare insurance, you're like, what's my copay going to be? I don't know what my deductible is going to be. We're like, no, it's just a monthly rate. That's it. And here's your rate. And that covers what we need.
It's a focus of telemedicine. What about like those, like, if we have like our primary doctors normally like, hey, you come into the office and see us once a year for this or get blood work or other things like that. How does that work? Is that something that you guys do as well?
Absolutely.
Okay.
Yeah. And
How
so
does that work?
We have some patients who want to come in for an annual physical and they want the hands-on in-person approach. And we're happy to provide that for people. So
that's great.
We have an office that people can come to if they want to be seen in person. And
you
so
said that you do things primarily, like you are licensed in like 15 different states, right? So because you have the office more so like Scottsdale, Arizona, stuff like that, if someone was to come to you for that type of in-person experience, do you have locations that you refer them to like in different states? Like, hey, we have the doctor, or is it like primarily for people to come if they want in person to hear, basically?
So as we're expanding into different states, that's obviously going to be more of a telemedicine. It's just, it's difficult for us at this stage to say we're going to have an office in each state, but rather we're going to have telemedicine because again, what we found over the years is so much of what we do can be done via telemedicine. And so even right now, as we're across the state of Arizona, we can get lab work ordered. That's all included in their membership fee is we do the lab work. And all of that is covered. And then we can go over it in person or over telemedicine.
Then the people that are working through this, through the company, they have access to you guys. Like, is it primarily you and Clay that are the ones providing the service with the telemedicine at this point? But you probably plan to build out other individuals or team members in the future? Yeah.
So we've already added on a women's health specialist
nice.
for the ladies who really want like that hormone-driven women's health.
Hey,
touch.
We need that in our 40s.
Yeah. And it's because there's a lot of nuance to that. And so we brought her on because she specifically just specializes in that. We have Clay is a psych NP. We have another mental health provider as well. So we're trying to just offer this robust package of as many people as we can get so that when you come to PracticeRx, we can take care of everything for you. And we can just legitimately provide an all-in-one solution for you so that I look at other people like me of the moms, the dads, the husbands, the wives, the people who are small business owners who are just busy and you don't have time to take 2 hours out of your day to drive over to a doctor's office to be seen and then you got to go somewhere. Like we just want to make it as convenient and easy so that you can focus on what's important in your life.
Well, you guys have very affordable rates compared to what the majority of us pay for insurance.
Yeah. And so that's one of the things that we really wanted to do is say, okay, there's no hidden fees. If you go on our website, every single fee is listed out. So that I know me personally, and this was a big talking point between us as we're building the business of, well, do we not list our prices so that people can reach out to us or do we just be upfront and transparent? And we chose to be transparent because me personally, when I go on a website to look for whatever it is, if they don't have the prices listed out, I'm like, I don't want to get put on an email list and a text list. So we want everything right there so that when you reach out to us, there's no surprises. It's here's what we offer, here's what we charge.
What is the difference between like traditional insurance, health insurance compared to your concierge service?
Yeah. So with our concierge service, it's you pay your flat monthly fee. There's no annual subscription fee. There's nothing like that. And that's it. You get 7 days a week, 365 coverage with us, where if you need something, you text us or call us. There's no fee for calling us. There's no fee for chatting with us. When you want lab work done, we include that. And then if there's medications that are needed, it's difficult for us to be able to have an all-in-one, like any medication in the world is covered. So that's where
like co-pays and stuff like that. Probably come up with specific types of
then we
medication.
just say if you need a medicine. So our men's health is the best example. If somebody just wants a flat subscription fee, then we would just say, here's how much the testosterone or your peptides, or if it's somebody who wants to be on a weight loss medication, here's how much your Manjaro will be or something like that. So we just want everybody to know. Whereas when you do primary care, half the time when our front office assistants would be there, people would say, well, what's my copay? And they're like, oh, we don't know. We have to bill the insurance first, and then they'll get back to us, and then we'll get back to you. And so a lot of times people don't know, and they're like, well, what's my deductible? Have I met my deductible yet? Once my deductible is met, then it's 80%. And so with us, we're like, no. What you pay, like, that's it. It's easy.
I think like for me, so we've been paying like $600 a month for health insurance for just 2 people. And I've had health insurance for 5 years. I've never used it. My biggest concern is if I cancel it and I get into like a tragic car accident or something, like, are we going to be covered? Like, what does that look like under the concierge model?
Yeah. So we encourage people because we don't have trauma services. I'm not a general surgeon. So I had appendicitis 2 years ago. Concierge medicine does not cover that.
Yeah.
And so we have some people that do like a cost sharing healthcare program for the catastrophic insurance, or they just have like a high deductible, low monthly premium for the in case you get in a car accident, and they just recognize that, okay, it's going to be a $5,000 or $10,000 out of pocket, but this is I haven't used it once in the last 5 years. But what people do need is, man, I got this sore throat today. Oh, I can't, I have this stomach bug. I can't stop vomiting. I have this weird rash that came up. It's not catastrophic, but it's something that you want to get addressed. So that's what that's the vast majority of what people legitimately need, is just to take care of the little things before they fester and become a big problem. And so when you have us and you have it very conveniently, there's no delay. There's no roadblock to getting the healthcare that you need. It's, I can just text Justin a quick picture of this rash on my arm and he can take care of it for me. Or, hey, my blood pressure medication
that's poison ivy. Stop going out in those ones alone.
Don't rub it on your face. Don't. I know we were hiking this weekend with my boys, and my boys are like, is that poison ivy? I'm like, let's just assume it is. Yes, don't touch it. And don't rub it on your face. So
just jump in it.
You need to say that when you have a 7-year-old. They're crazy. So
they might be attracted to it more. I know. It is. Let's
so I can touch it. Like, please don't touch it. Gosh dang.
Exactly. Yeah, no, it's good to know because I had that question because in my thought, because like during COVID, I actually had used telemedicine options to, they're like, oh, we'll ship you a COVID test or, all these things. And that was just the way it worked, of course. Yeah. But I was like, I would rather support a company that also has been built by entrepreneurs versus these mass streaming ones that you're like, you're booked with this doctor this time. I love the fact that you have that personal attention, that detail. Of course, you guys will grow as well. And like, I would rather be like, I'd like to switch to your, company just to help support that too.
Right. And that's like, we're not a large, like I used to work for primary care and they got bought out by this big investor company. And so we want the personal touch to be, hey, you get us, like we're on the website. This is who you get. When people are watching this, you'll probably end up talking to me on the phone. And so
you're like, it's Justin.
Hey. And so like you talk to me and you talk to Clay, and like I had that gentleman while I was on the camping trip, like I was texting him like before I went to bed at 9:30 and I was like, hey, it's already sent in. Like it's no big deal for me to take 2 minutes to refill a medication. And I'm willing to put in, like our philosophy is we want to do everything that we can to be there for our patients so that we build a relationship with them and we build a trust with them. And, we
100%.
We want to do events down the road where we do wellness retreats and activities and we do monthly get-togethers of like, we want to do physical activities and get people together to really like almost build more of a relationship and build a camaraderie where people, they know us, they trust us, and we know them. And you get to know people outside a normal setting. And when you trust somebody, you're willing to go to them more because we're not just a reactionary medicine company of tell us if something's going on. We want to catch things before they happen. And so in addition to doing like urgent care services and family medicine, we have a whole robust preventative healthcare side with full body MRI scans and ultrasounds and screenings. And we're really excited. We have one of the most robust biomarker packages where if you do our annual physical, I think it's 60 pages worth of biomarkers that we will give you and we'll go over with you. So we try to prevent things from becoming a problem and to keep you healthy and to do anything that we can so you can live your best life like right now.
What are some examples of the biomarker results that you see?
Yeah, so a lot of it is going to be you're going to have all of your blood work that shows like, your blood count, your platelet count, your electrolyte levels, your kidney function, your liver function, your cholesterol, your lipid panel, the ratios, your hormone levels, adrenal glands. I think we can also involve like your cortisol levels. So we have all of these different markers that are included to really be able to see like where are the deficiencies, where are things looking good. If somebody, I know that as a 40-year-old father of 3, small business owner myself, that the most common complaint that I personally feel is like, I feel fatigued. And so like a lot of people, that's their number one complaint when they come to us. They're like, man, I feel like I'm low energy. And we're like, well, let's look through all of the blood
That was
work.
me this morning.
I know, right? I'm like, so caffeine, it's a friend.
She was like, you feel great. I'm like, I feel great.
Yeah. And so we'll look at stuff and we say like, well, do you have an underlying issue? Is your testosterone levels really low? Are you anemic? Is your liver function not looking well? Is your thyroid function off? And once we can look at all of that, then we make a roadmap for everybody of, well, how can we improve? And it's not just, a lot of times our treatments are not, well, let me give you a medication. It's like I had a patient who he does not need medication. He needs to legitimately change his lifestyle. And so we went to the gym together and I literally walked him through, and I'm not a personal trainer, but he's never been to a gym. And he's like, I'm really uncomfortable. I'm like, well, let me break down that discomfort for you. And let's just go through a full body workout. And then let me take you to Costco and because I love Costco. Like any excuse.
Bulk,
any excuse to go to Costco, like count me in. But so then we go to Costco and I'm like, how can you make good food choices? And he's been super excited. He texts me every week and he's like, dude, I'm down 15 pounds.
He's going to buy in bulk.
Yeah, because he's buying all this healthy food. He's getting jacked. No, but he's feeling so good. And he's a month in and I think he's down like 8 or 10 pounds. And he's just excited because he's making changes. And for him, the right answer for him was not, let me give you more medication. It's, no, let's fix your lifestyle. And then let me help you so that it's not so scary. And that's the kind of relationship that I want to build with my patients, my clients is I want to help you. And whatever the right answer is for you, it's not a one size fits all. It's not just, okay, you come to us for weight loss. Our automatic answer is, I'm going to put you on Mounjaro. No, or Ozempic. It's sometimes, if that's the right thing, absolutely.
The showing that you guys care, that goes a long way. I know that us being in the service industry as well, in a different, category, of course, but that's one of the things that we've always been told. It's like, you guys show up, you show that you care. There's a seamless process, but you show you care. Yeah. And I think that speaks volumes to people. And whenever you're able to share it out like this even more often, I mean, it's cool that people are going to be able to find you guys through this content as well. So I'm excited. Yeah.
And as we're growing the business, like we really just want to build those relationships with people and let them know that like we legitimately are in this because we care and we want to help people. And Clay's married. He's a father. Like we're both like family people. And I feel like we just want to help other people around us to be as healthy and happy so that they can live their best life. And we want people to enjoy whatever their goals are. If they want to play pickleball or if they want to be doing backpacking trips with their kids, if they want to be able to walk all day at Disneyland, if they want to go on a backpacking trip solo, if whatever it is, if they just want to wake up and not hurt. Everybody has different goals. So I'm like, well, we have time to chat with you. Like I can chat with people for an hour on the phone or in person and really get to know them and figure out what do you want? What do you need? And I always joke with people like healthcare is such a fascinating thing because you can have 2 patients and you see both of them in 5 minutes. And one person can give a Google review and say, best experience ever, 5 minutes in and out. Amazing. I loved it. So good. Like so efficient. And the other people, worst experience ever. 1 star, hated it, in and out in 5 minutes. I feel like they barely talk to me. So
that's my mom.
Right? And so that's my mom too. Like
she wants to feel like she's being heard. And that's the one thing when she ever goes to regular healthcare practice, she's like, I don't feel like they listened to me. I was only in there for 5 minutes.
Yeah. And so like if we have a patient who wants a longer experience, then we will talk to them. And we have other people. Myself, I'm like, all right, and go. And then we're done. I'm like, heck yeah, dude, that was 3 minutes. Like, I'm excited. I'm like, I needed this one thing addressed. Can you address that one thing? And so whatever it is that our patients need, we want to address that. And if people want to have a long, in-depth where we cover everything, absolutely we'll do that. It's what do you want? And so we're not constrained by insurance. We're not constrained by anything at all. It's just, we want to help you. So whatever you need, just let us know. And it is interesting to see how different each patient is and what their needs are.
Mm-hmm. Do you build like specialty referral partners? Like obviously you guys focus on specific types of areas. So let's say example, my mom failed the dementia test, right?
Mm-hmm.
So she's going through different things. She had some things with like the nervous system. She's gone to chiropractics, just as an example. So the doctor primarily just sends her out to all these different specialties. Do you partner or have specific people that you refer when there's things that you maybe are not in your scope on that side?
Oh, for sure.
Okay.
Especially here in Arizona. And again, Arizona is, I mean, me and Clay have been working here for, I mean, between the two of us, like, I think we're close to 15 plus years of healthcare within the Phoenix metropolitan area in the state of Arizona. So we have so many different, like I have neurologists, we have general surgeons.
Mm-hmm.
Now, they're not part of our concierge business, but
Of
we
course.
absolutely have people that we trust and that we can refer people to
up.
if they need something.
Yeah. Yeah. No, I love what you guys are doing. I think it's very valuable, super important on that side. I know you guys are growing. Obviously, you guys are here in the Arizona area. If someone was to reach out, wanted to connect with you guys, learn more about how they could work with you if they're here in Arizona or if they're in maybe one of the other 15 states, maybe you can list the 15 states. You're like, I got them right here. Or we can list them on the site.
We'll
Awesome.
list them in the show notes.
Yeah, for
Put
sure.
me on the spot. That was awesome.
Could you share a little bit with our audience, a little bit how they can connect with you, if it's personally, if it's LinkedIn, it's a website, all the above?
Yeah. So our website is the easiest way, Go PracticeRx. That is probably the easiest way to get a hold of us. I'll even give you my personal cell phone number. It's 602-717-5817. It's literally my phone number. You can call me, you can text me, and I'm happy to answer any phone calls or questions that you would have. We have a general email, like my personal email is justin@gopracticerx.com, clay@gopracticerx.com. If you just have general questions, you can email either one of us. But that's our approach.
I love how brave he is to just give out his cell phone.
I know part of me is like, should I do? I'm like, well, yeah, because I give it to our patients.
Yeah.
And
Yeah.
like,
No, that's how confident you are in what you guys provide. So I think that's really a great way just to explain to our audience,
Yeah.
On that side.
Yeah. And the personalized approach is amazing. So
yeah, we're really proud of it. And, as I got into healthcare and coming from like working on the fire department and working on ambulances and really doing that reactionary side of, okay, I will respond to an emergency. I loved that. And I did emergency medicine for years as a PA, but I really like preventing those emergencies from popping up and being able to help people like on a day-to-day basis feel like they're just feeling good.
Mm-hmm.
That's our tagline is we want people to feel good and live better. So we want you to feel the best that you can so you can live the best life that you can. And whatever goals that you have, we want you to reach those goals. So it's different for everybody. It's a personalized approach and it's not a one size fits all. It's we get to know you and we found out what do you want and then we help you with that.
It's really good for the entrepreneurs for sure and the business owners and biohacking. It's good for everybody. But I mean, like for us just wanting to have more energy and because we have a lot of obstacles that we encounter in the field. And so knowing our biomarkers is really important.
Yeah, and there's so many things that we offer. Like we have our telemedicine urgent care service that we're throughout multiple states. Like that's obviously something that we do, but we also do biohacking, we do peptide therapy, we do stem cell therapy, we do stem cell injections, we do hormone therapy. Like we have all of these things because whatever it is that people need, we want to help them and we want to maximize your potential and maximize how you feel. So there's all these buzzwords that people can use of like biohacking is, thank you, Joe Rogan, is like the most popular thing in the world right now. But there's so many things that entails. And so we can just explain like, well, what does that actually mean for you? And just go through step by step and talk about the different options.
I love that.
For those of you watching, be sure to subscribe, leave us a review, follow Justin, see what he's up to, and definitely work with him. I think I already know 100% where I'm going on the telemedicine side over here. So you guys are going to build a new relationship with me, Danielle, and other people watching this video. So again, appreciate you guys, and we'll see you in the next episode.